at Sonoma. So we will be consolidating down by one non-certified residence from 4 to 3 during this coming fiscal year.
To the panel, any other presentation or testimony on this item? Director Rogers?
I didn't hear all of that.
Well, I was asking if there was any other testimony on this particular item from the panel.
So.
Great. Anything from LAO Finance? Any questions from the committee? Mr. Bonta.
Thank you for your presentations. I just wanted to raise some questions and concerns about the timing and the closures for the closures of the DCs, and just query whether it makes sense to have timelines at all at this point, and to allow for best patient outcomes to drive what those timelines are, to make sure that every patient has an appropriate transition in their placement. And also, besides patient outcomes, which is certainly the top priority, which I think should drive the timelines, keep in mind the importance of making sure we get good placements for the labor, the workers who will be losing their jobs, to make sure that they can potentially get maximize their opportunity for good community placements. So it just feels like we're prejudging the timing instead of allowing the patient's best outcomes to drive that timing. It may take longer. Some of the other closures of facilities has taken longer. So I just want us to be open-minded about timing that could be longer than what's been proposed.
Assemblymember Bonta, we completely understand and embrace what you just suggested. With the process I alluded to a few minutes ago, relative to our ongoing funding relationship with the Centers of Medicaid and Medicare Services, that dynamic of specifying a realistic time period is all part of the negotiations as we move forward. But we have, in our past, as you talked about, is a constant at each step of the way of assessing that as we move forward. I think from our experiences, it's better to have a very specific plan of action and with the flexibility of looking at it and adjusting it as necessary. So we heard what you have to say, and we want to put it in that context, though.
Thank you. I appreciate the open-mindedness to flexibility and adjusting to other factors. I think the stakeholder group for the Sonoma County DC closure is a very helpful one to provide everyone with an opportunity to have input and make some suggestions as to how that closure should proceed and when, and that might be appropriate for the other DCs as well. So thank you for being open-minded about the timeline. I get there's a placeholder for now, but I think there might be some strong mitigating factors that suggest a longer timeline.
Mr. Chu.
Thank you, Mr. Chair. I just want to also echo our colleague, Mr. Bonta's comments on this and really note the LOA's observation that, again, the proposed schedules for these closures are faster than other closures. I think we need to, again, figure out what is in the best interest of our patients and ensure that we have measures in place that ensure the health and safety of these residents as we transition. We need to do this the right way. So I just want to add my voice to that.
Okay, thank you.
Thank you. We'll move on to the next item, some program improvement plan updates.
Thank you. This is just a reduction in the current year funding for slow startup on getting the so-called PIP positions started at Fairview and Porterville. In the coming year, it's just a calculation error that's being adjusted. The wrong rate was set for the different facilities, so that $1.2 million in reimbursement authority is just a calculation error that we're fixing.
Anything else from the panel on this? From the department, anything? Anything from finance or LAO's office? Any questions from the committee? Seeing none, let us move on. We're leaving this item open. Let us move on to expansion of the secure treatment program at the Porterville DC. If there's an update, please.
Yes, the difference here between the January budget and May is that we're proposing to increase the cap at Porterville from 202 to 211 persons. It's in statute right now is 230, but really only 170 of those are in the secure treatment area at Porterville, and 60 of those are in the general treatment area. What we would propose to do is to stop admitting adolescents. We've only had a couple right now. The adolescent residence is empty, so we could use that space to help us clear the waiting list that we have for people who need secure treatment services to come in. So that would allow us to essentially take 9 more people and eliminate some of the overcrowding that's occurring on some of the older residences within the secure treatment area at Porterville. So that is that proposal. We also do take out the transition bed language in the trailer bill this year. Part of that is simply because the beds exist there. We're only using about 30 right now. We've had 69 admissions and 49 discharges through that transition placement program since 2009. So we're finding that's a fairly successful program, but we're just not using the capacity at this point. So the beds will continue to be on the 3 residences where transition beds are designated, and they'll be available for use. And we're also using Canyon Springs quite a bit as direct their transition services as well for folks to come out of secure treatment at Porterville and then be able to move to less restrictive placements in the community. So that's the proposal for this year.
Would you just shed some clarity for us on how you reconcile you're lifting the cap, but you said you hadn't reached capacity? Just give us some clarity on how you reconcile that and why. What's driving that?
Right. The cap was 230 statutorily, but really that's 170 beds in the secure treatment area and 60 beds that are in the general treatment area outside, what we call outside the fence. So really the cap is 170. So all we're proposing to do is open 2 residences and use the adolescent residence, which would allow us to admit 41 additional people and allow us to have the total treatment capacity in the secure treatment area so that it doesn't get confusing in the future. Just refer to the secure treatment area as the cap there being 211 because that's the number of beds that are behind the fence.
Got it. Thank you. Anything from Finance or LAO on this? Any questions from the committee? Ms. Grove.
Thank you. You mentioned that even though it's just a small number of adolescents that are per se behind the fence or the secure treatment area, what do you do with those adolescents if you change the facility to an adult facility?
Well, for one, we, I think, provide them better opportunities because, frankly, the secure treatment area is not the best treatment facility for adolescents. They just don't tend to fit very well there. And we do have other programs there that it negatively impacts to have them there as well. So while folks are adolescents, they have a few other placement options. The people who are adults are in jail and need to be out of jail. The folks who are adolescents have other options like juvenile hall and other community, less restrictive community options available to them or will be making available to them. So we just think it's a better treatment approach for adolescents to not come into secure treatment.
So I guess my question is, if they're intended to go to secure treatment, is juvenile hall or I've read some stuff about adolescents and the crimes that are committed by adolescents. A 13-year-old girl, this pencil hole, the whole issue that happened with the pencils and all that stuff. I guess my concern is that if they're in juvenile hall, you have a kid that maybe is a runaway or maybe acting up or whatever the case may be, and then they get put into a position to where they're having day-to-day interactions with somebody who is determined to be I don't know if criminally insane is the correct word, but someone who is supposed to be secure. And now I find myself concerned about the safety of the people in juvenile hall or the other options. I guess my question is that if it's just a developmentally disabled individual, and I believe that they can live and interact with all of us, but if it's somebody who is needs to be secured because of their extreme violent and sometimes deadly behavior, how do you integrate that type of person into society or into another group of individuals without causing concern?
Well, it is a difficulty, but these individuals are still regional center clients, so we would have to find a way to wrap services around them just like we do for anyone else who's having crisis-type needs.
Okay.
So I'd see that we would approach it more that way.
Okay, thank you.
Thank you. We'll move on to the next item, which is Issue 6, Other Developmental Center Division Proposals.
Sorry, the first issue there is just a population adjustment. This is just a true-up of the population from what we project in placements versus what actually happened. So this just helps us readjust for that funding. It increases by $0.4 million, a net reduction 18 positions because of that population difference that occurred. And it also decreases the number of non-level of care positions. Again, that's a staffing calculation. We had in error applied a 24-hour relief factor to non-24-hour positions, and so the reduction of that is just that fixing of that calculation error.
The next issue, Mr. Chair, is the Sonoma Pump Creek Station. The governor's budget proposed $1.6 million to repair the damaged Pump Creek Station in Sonoma Creek, which is located on the Sonoma Developmental Center campus. However, given the ongoing drought conditions, the current situation that we're facing, and the need to pay attention to curtailing water usage, and state agencies and departments are working very hard to do that, we are reconsidering this proposal. We are looking at it in light of, what's the need that we have for our consumers that are there, and what's the need that we have for fire suppression. But beyond that, we think that this is maybe something that could be looked at broadly as part of the entire closure plan for Sonoma Developmental Center.
Hi, Nancy Bargeman. Related to the next item is headquarters request, and it's related to issue 1 earlier in the agenda. This is the $1.3 million to support the state operating supports to develop the resources in the community that we had earlier discussed. And it's for 7 positions within the Community Services Division at the department, as well as providing an interagency agreement with the Department of Social Services for a position to expedite licensing process, as well as a contract for a housing specialist from the legal department to be able to provide oversight and support for all of the housing development.
And then the last issue you have there is the Foster Grandparent Senior Companion Program. This is simply a transfer of the Lanterman program to San Gabriel Pomona Regional Center as part of the last bit of the Lanterman closure.
Thank you. Anything from Finance? LAO's office on these proposals? Anything from the committee on these proposals? Ms. Grove.
Thank you, Mr. Chair. What happened to the 18 people in those positions, the 18.7 people? DC population staffing adjustments. What happened to the 18.7 people? Or are those just positions that were vacated, not filled, that were budgeted for?
They'll just attrit away. So they're already, for the most part, not filled anyway because of as the pop reduces through the year, the DCs don't fill the positions as they become vacant.
Okay, so they were never filled positions in the first place.
They were filled, but as attrition occurs, as the population reduces, they just tend to not fill them.
Okay. And then on the second part, the reevaluating Sonoma Creek pump station, not the third item, but the second item, are you suggesting that we invest money in that when we're trying to close these things down? And if you did invest money in that, can you give me an ROI? Like, what's our return on investment? Is it going to take us 10 years to get our money back if we do this savings, and it's going to be closed in 3 years? So why would we? That's a bad investment. I mean, I'm asking you, are we going to get our return on our investment for water savings in a period of 3 years from the closure date?
Well, the original plan was to invest the money into the repair so that we continued to meet the requirements for water use under the water rights laws that apply at Sonoma Developmental Center.
Okay.
By repairing the pump, our concern was that it would maintain the value of the property. If we lose those water rights, obviously the property value declines, and that was our primary concern initially.
When would the repairs have been completed?
The repairs would have been completed, I believe, in fiscal year 18-19.
So it's after it's closed.
Right, and that's, again, why we're looking at it broadly to see how does this fit into what the Sonoma campus will transition into.
How much have we spent on that estimated plan, whatever, yet? Have we spent any money on it yet?
The plan for repairing
the plans for repairing the
1.6.
We've never had an engineer come out, nothing like that?
Nothing that we
yet.
can't fund out of our own budget. I'm
Okay.
assuming DGS may have come out.
Okay.
But, yeah.
Thank you very much. So I guess what you just said is that this repair for the Sonoma Creek pump station won't even be repaired, even if the plan does go forward till 18-19 or 17-18. What'd you
That's
say?
my understanding based on the timeline. It depends on the.
And the governor in his May revise has proposed a closure date for Sonoma by 18.
Yes, we're proposing to close it by the end of 18.
Okay, thank you.
Thank you. Moving on to the proposals in the Community Services Division.
Nancy Bargeman. Regarding issue 7, caseload and utilization, current year there's $76.9 million increase reflected in updating caseload utilization and expenditure, as well as under the $7.9 million, it's actually broken out. One is in operations. $1.6 million of that $76.9 is of operations, and in purchase of service represents $72.3 million increase. For budget year, it's an increase of $120.8 million, which is also reflecting updated caseload, expenditure data, and then utilization. And broken out, it is in operations $2.5 million of the $120.8, and then in purchase of service is $118.3 million of the $120.8 million.
Anything from Finance? LAO's office?
Sean Martin with the Legislative Analyst's Office. We've reviewed the department's projections for caseload, and we find them reasonable. We're not recommending any adjustments at this time. We also earlier in the year testified to the fact that for supported living services and certain community care facilities, we felt that the amount of federal match that the department was drawing down on its general fund expenditures was lower than had been the case historically. And so we have been working with the department to better understand why this is occurring. We believe in part it may be that in some previous years, they may have overestimated the federal match, as we're going to talk about later on. There's a current or a prior year deficiency that may be related to that, and we're going to continue working with the department to better understand their methodology for forecasting their federal funds and their general fund and how they're coordinating that. The department has indicated to us that that's a priority for this summer, and we're going to continue to monitor and work with them on that.
Thank you. Any questions from the committee members? Seeing none, we'll move on to the issue of Federal Labor Standards Act updates.
Yes, this item updates the overtime rule related to the Fair Labor Standards Act. And what the department is proposing, as the agenda correctly points out, the Federal District Court ruled in January that this overtime rule would not go through. It's being heard in appeal, and so at this time we recognize that there won't be a need in the current year for additional funding. So the budget proposes to remove $20.7 million in 14-15 that was originally earmarked for that purpose. In 15-16, given the uncertainty about what may happen with the appellate court, we do have funding in the budget. We have $43.3 million included in the budget in the event that there is a change and that the appellate court moves the overtime rule forward.
Thank you. Anything from Finance? The LAO's office? Committee questions? Seeing none, let us move on to the next item.
Okay, issue 9, minimum wage update. The governor's budget estimated $106.5 million in response to the minimum wage increase from $8 to $9 that was effective July 2014. So going to the May revise for current year, we're reflecting actually a decrease of $31.2 million in purchase of service, and then this is really related to the fact that we had built the governor's budget with a broad assumption, and now that we have some detail and data as far as the providers that have received the rate increases, we really have a bit more clarity as to what those assumptions are, therefore reflecting the decrease of the $31.2 million in current year. In budget year, we are assuming no change in the projection of $62.4 million, really recognizing that the change from $9 to $10 an hour that there is likely, and certainly stakeholders have shared this as well, is that there's going to be more providers and staff that will be impacted by the increase from 9 to 10 as opposed to what was experienced from $8 to $9.
Thank you. Anything from Finance, from the LAO's office? Questions from the committee on minimum wage update? Seeing none, let us move on to the next item. Transition of residents of DCs into the communities and the related costs.
Right. So regarding what we call continuation funding, and this is regarding Issue 10, transition of individuals moving to the community from the developmental centers. Within the first year of placement, we have the funding from Community Placement Plan that covers the cost of placement. So anybody who had transitioned to the community in the fiscal year of 13-14, Community Placement Plan covers those costs in current year in 14-15. Then what happens is that in the next year, what we're looking at is then since the funds are not in the trend and it's not covered by CPP, that we have continuation funding. And then in the third year of the point of the person who's moved from the developmental center, it's now in the trends. So understanding that in current year, we have $21.4 million representing an increase, which is above what we have in governor's budget of $4 million. In prior estimates, what we've done based on the $4 million was on old assumptions and methodologies. And right now, moving forward, what we're going to be doing is doing a projection as far as the true cost based on the actual number of individuals who've transitioned from the developmental center and the true cost of what their related costs are. And then going to budget year, we're assuming then $37.9 million as an increase for those continuation costs for the individuals that are transitioning to the community during the fiscal year 14-15, which in fact would then be the continuation cost in budget year.
Thank you. Anything from Finance? LAO's office? We'll move on. Any questions from the committee? We'll move on to issue 11, serving consumers with behavioral health needs.
So, yes, with issue 11, related to this item, we have $3 million reflecting a decrease in purchase of service to update the caseload of consumers that would be receiving the behavioral health treatment services through the Department of Health Care Services as a Medi-Cal benefit beginning in the fiscal year of 15-16 per Senate Bill 870. We have this information based on our updated numbers, therefore reflecting this decrease.
Anything from Finance? LAO's office? Questions from the committee? Were you going to add something?
Mr. Chair, if I may, just as the agenda notes the prior year general fund shortfall that is also included in our budget, the department is asking for $61.6 million general fund in 2015-16. This shortfall is related to a number of billing years where we have, the department has authority to go back and bill prior years for specified services that the federal government will participate in costs. So for day programs, transportation, we're able to go back, and we were able to go back as far as 9-10. And we brought in a significant amount of federal funding that we used to replace general fund costs. So we were able to go back for a number of years and do that. However, as time went on, we started to recognize that we were trying to repay general fund loans that we take out related to the services that we provide through the regional centers. And in 2011-12 and 12-13, we came up short in our ability to repay those loans because a lot of the general fund that we had already brought in had been scored as savings to the general fund. So what this proposal does is it tries to account for the shortfall that we have given the fact that all the federal funds we thought would come in didn't materialize, the fact that some were scored against prior years. So it's basically trying to correct a couple of things, an accounting issue for one, and then it's noting that we were not able to bring in the type of federal reimbursements in 11-12 and 12-13 that we originally expected. So we will continue to monitor that, but that's what this proposal adjusts for in 15-16.
Thank you. Any questions from the committee? Seeing none, if you would take us through the proposed trailer bill language for the pilot or for community placement plan funding.
Yes. Actually, there's two items on the proposed trailer bill language that I'm going to go ahead and speak to. It's actually in response to the statute that gave us the authority to develop an enhanced behavioral supports home last year, which is the pilot that's referenced in the agenda. And given the authority to develop the new homes, in statute there was a cap as far as the number of homes that we could develop within any community place plan year, which is 6 homes per community place plan years. So what the statute does is it lifts that cap and gives us the authority to develop beyond that while maintaining the pilot status of the projects. Certainly with understanding the need for us to develop the capacity in the community to support the individuals transitioning from the developmental centers, we're asking to be able to do this through statutory changes. The second one is with the delayed egress secured perimeter homes. When the statute was enacted to give the authority to have delayed egress homes that has a secured perimeter back in 2012, part of the requirement within statute was the requirement to have federal funding associated with it. During that time, we were certainly watching the new federal rule regarding the home and community-based services regulations from the federal government. And during that time when we put it forward, we certainly had the understanding or intent of being able to comply with the regulations that the CMS has. However, when the final rule came forward with HCBS regulations or with the CMS regulations, the concern that CMS had, which they outlined in a letter in April of 2014, is that the delayed egress secure perimeter homes would not be in compliance. We are working with CMS on this. We're also going to be addressing it through our home and community-based transition plan to be able to move this forward, but understanding the significant need right now to build the capacity to support individuals with a forensic background. We are wanting to build this capacity very quickly and ensuring that we are able to do so on a timely basis. We're asking to edit the statute to remove this requirement for federal funding.
Anything from Finance? Anything from the LAO's office? Questions from the committee? Ms. Grove.
Thank you. What's the total federal funding that we get for developmental centers? Total federal funding for DCs.
For developmental centers, the total federal funding is approximately $250 million.
$250 million?
Yes. And we can confirm that number, but that's approximate.
Okay, thank you.
Thank you. Moving on to the next item, update on Shannon's Mountain.
Thank you, Mr. Chair. The department has been working with the Department of General Services, the Health and Human Services Agency, and the Government Operations Agency to develop trailer bill language to allow the Shannon's Mountain project to move forward. As the agenda points out, this project was initiated several years ago. There were some legitimate concerns that were raised by DGS regarding legal authority, and we've worked through those. So the trailer bill language that is proposed as part of May revision does several things. It allows a lease of up to 20 acres at the Fairview Developmental Center site for housing for individuals with developmental disabilities, and that lease would be available for no more than 55 years. It specifies and a lot of this will be handled through a request for proposal that will go out, but it specifies that 20% of the units on the in the new project will be required to be made available for individuals with developmental disabilities, and that percentage can be higher. And for individuals that are or any developer that's submitting a proposal for the project, there'll be a point system. So the more that they set aside for housing, for affordable housing for individuals with developmental disabilities, the more points they'll get under this system. It authorizes DDS to provide project management, oversight, and general operations similar to what we do with the project that is located at Fairview now, Harbor Village. So we provide similar general oversight for that project. It authorizes the department to participate in any proceeds that are generated from the operation of the project, and funding will be used to subsidize rents. It will also be used to modify living units as individuals move in and out of the various units on the property. There are oftentimes a need for modifications related to the individual's specific disability. So it may mean that showers, things like that, have to be changed, or there's a host of possible modifications that have to be made. So this addresses those concerns, and it also the language also provides that even though it exempts the project generally from some of the stipulations of a public works project, it does require that the project pay prevailing wage.
Thank you. Anything from Finance, LAO's office? Committee member questions? Is there anything else on the trailer bill language related to this item? Okay, we'll move on to the next item. The proposals, other community service division proposals.
So the first issue is related to the reduction in revenues for the Program Development Fund. This fund receives revenues from two sources: the annual parental program fee and the parental fee program. In current year, we are looking at a reduction of $1.3 million in revenues, and we're proposing to offset that by a $1.3 million increase in general fund. This is due to decrease in population numbers from our original assessments and payment information associated with this program. In budget year, we're looking at a decrease of $1.4 million in 15-16. The decrease is due to $400,000 of it is due to decreases in the annual family program fee. The remaining $1 million is due to decreases in the parental fee, and the decreases in both are related to kind of reassessing what the population looks like. On the parental fee program as well, we were proposing to implement a credit card payment system in the fall, and that was delayed, so that had some impact on the revenues that we'll bring in the both current year and budget year.
The next item for issue 13 is related to the Healthy Workplace, Healthy Families. The May revision includes a 1.7 increase over governor's budget for the cost associated with the service providers providing sick leave for their employees. This reflects really just an updated based on our expenditure data.
Question from Member Grove.
Thank you. I have a general question, only because we didn't cover OPS here today, but I want to know if somebody can answer this question. If the Office of Protective Services investigates a incident inside the DCs and it requires outside law enforcement to be involved, is that report submitted to outside law enforcement directly, or do you have a policy in place which requires OPS to submit that to the department in Sacramento, and then the Sacramento people decide what goes to outside law enforcement? Do you have a policy in place like that?
Yes, it's reported directly to outside law and within the 2-hour time frame.
So you're saying that all incidences are reported to outside law enforcement, and the complete investigation is sent to outside law enforcement and not to Sacramento first?
Let me see if I'm understanding you correctly. There are some specific in statute requirements for when incidents are reported to outside law enforcement, and there's a 2-hour time frame for reporting those. Mm-hmm. So as soon as those incidences are reported, then they are reported by OPS to their local law enforcement jurisdiction for them to determine whether or not they will come in and do the investigation.
I understand that. My question is that so OPS does an investigation, investigates it, does the report, takes witness statements, gathers all the information, takes photographs, just like any other officer outside would do it. But the OPS department does this. Is there a policy within your department that requires OPS to report their findings to Sacramento DDS or to DDS at a higher level? Or can they take that investigation that they found and immediately transmit it to outside law enforcement without the authorization of the department?
There are really two paths. The outside law enforcement investigation is independent of anything that OPS does. Usually, if it's going to be a criminal investigation, they would take that. If the outside law enforcement takes the investigation as a criminal investigation, OPS does not do a criminal investigation. They do the administrative investigation for the most part. But in either case, whether or not it's a criminal investigation or an administrative investigation, all the investigations are reported to Sacramento.
Do you have a policy that requires all investigations to be reported to Sacramento, and then Sacramento decides what goes to outside law enforcement, or is OPS free to give any information to outside law enforcement?
OPS is free to give any information to outside law enforcement, and that would come, again, with the instigation of the incident, not during the course of the investigation.
But even during the course of investigation, they can provide them with information outside law enforcement?
Yes, absolutely.
Do you have a policy against any retaliation for an employee under OPS that provides information to outside law enforcement if they are retaliated against? Like in the real world, if somebody filed a complaint and they were retaliated against, it would be against the law. Is it also not proper for your department or the department to provide retaliation or to retaliate against an employee who provides outside information to law enforcement?
Yeah, I think we would cover that under whistleblower.
We have whistleblower laws for that.
So
let's move on to the next item, please. We're going to move on to early start, please.
Yes, with Early Start, the May revision includes a $9.8 million increase in budget year for the children that are newly eligible for Early Start under the expanded eligibility, which was effective January 1st, 2015. This increase is really necessary because the budget only included 6 months, and so we're going ahead and making this correction so it reflects a full year. The last item for Early Start is a general fund offset due to the reduction of the Early Start grant. So this grant is $500,000 decrease in Early Start Part C federal grant, and again, this is just offset in general fund of $500,000.
Is there anything from finance on any of these proposals? Anything from the LEO's office?
Sean Martin, Legislative Analyst's Office. With regards to the Healthy Workforce, Healthy Families Act of 2014, we recommend the legislature approve the governor's proposal and adopt supplemental report language to require the department to provide the actual general fund costs of these proposals.
Thank you. Any questions from the committee about any of these proposals? We'd like to invite the public to come forward and have public comment on any of the issues that we heard in DDS. Thank you to our panelists for your presentation. Thank you. Public comment is 30 seconds. State your name, your position. If you could do it in less, we appreciate that. We have a very large agenda of health items to also go after this. Please.
Randy Cheek with SEIU Local 1000. We compliment Assemblymember Chu and Bonta for their comments about the flexibility. We know that Agnews and Lanneman took a lot longer than 2 years to close, and we feel that that there should be some flexibility in that. We also like to point out that the task force that was created by Secretary Dooley noted that there are 32% of the population who have severe multiple medical needs, and about 16% of the population has severe behavioral needs, and that there was a need for both a Northern and Southern California acute crisis care centers that we think should go forward that we haven't seen in these proposals yet.
Thank you.
Mr. Chair and members, Sue North with California Disability Services Association. We want to applaud the administration on the actions that they've taken on the state developmental centers and would support implementation of those requests. With respect to the community, we take great hope out of what we've heard here today from the committee members and the chair, and thank you for your commitments to helping the community survive as we all move forward. I wanted to just end with a real quick quote from a person who's part of our association, couldn't be here today. She's the exec for the Marin Ventures program in Marin County, and the reason she can't be here is because 2 of their transportation companies have gone under, and her own agency has taken on 30 clients, but there's about 170 clients involved with this problem, and many of the consumers served by the agency are unable to use any kind of public transportation. They have complex needs and wheelchairs and can't work.
Please.
So the more we need help soon.
Let the director know I know the agency well and thank them for their hard work. Thank you very much.